a lot of people don't realize how close the cranial nerves actually run to the cervical vertebrae. And today I'm going to talk about how the vagus nerve actually can be the cause of burning mouth syndrome. Anybody who's seen anybody with burning mouth, it's just horrific. I remember my first case, it was something like 25 years ago, and the person had had so much dental work done to try to get rid of the burning mouth. Then they went to holistic providers and they tried gluten-free, dairy-free, this herb, that herb. Eventually they sought out care by a chiropractor who felt that the problem was upper cervical instability, and that chiropractor did them a big favor, and the person received prolotherapy and did great. See, the vagus nerve runs right along the anterior border of C1, C2, and it runs in the neck down into the digestive tract. So the vagus nerve here can easily be compressed or stretched by excessive movement of the C1, C2, C3, and other cervical vertebrae. The vagus nerve has connections, direct connections, with the facial nerve and the glossopharyngeal nerve. And these three nerves, the facial nerve, glossopharyngeal nerve, and vagus nerves, they basically are the nerve supply as far as sensation goes to the tongue. The movement of the tongue, that's the hypoglossal nerve, and the hypoglossal nerve actually also is in this area. And it also has connections with the vagus nerve. But specifically, the facial nerve, which is cranial nerve 7, the glossopharyngeal nerve, cranial nerve 9, and the vagus nerve, cranial nerve 10, are interconnected. Upper cervical instability can nudge on the vagus nerve, and you can actually get what's called vagus neuritis, or you can get hypoglossal neuritis or facial neuritis, all because of upper cervical instability. And the burning, the irritation, the awfulness of that horrible pain in the tongue, on the roof of the mouth, in the back of the throat, can just disable somebody. When the pain is just in the tongue and it's not anywhere else, often that's irritation of the facial nerve. When there's burning also in the back of the throat or in the palate, the roof of the mouth, that is indicative of glossopharyngeal and vagus nerve irritation. Then, of course, that's good to know that, and often that's because, like I said, is from upper cervical instability. In every case I've ever seen of burning mouth syndrome, the people also have other symptoms, and the symptoms can be dizziness, ringing in the ears, clicking in the neck, migraine headaches, tension headaches, speech problems, swallowing problems. A lot of these symptoms, again, are problems with the vagus nerve. How we analyze cases beside just physical exam is digital motion x-ray. Digital motion x-ray will show the looseness or the instability. There's lots of different clues that the vagus nerve is involved, and one of them is to actually look at your uvula, in a mirror, put a flashlight going toward the back of your throat and go, ah, ah. And when the uvula deviates to the side, we just call that a deviated uvula, that's a sign that one of the vagus nerves is not functioning correctly. Another way that you can tell if the vagus nerves aren't doing so well is where you have decreased sensation, like in the tragus part of the ear, because the vagus nerve innervates that. The good news is for all of this, if a person does have burning mouth syndrome, there is a treatment for it that's very successful, and that treatment is prolotherapy. Prolotherapy is the only treatment that I know of that can tighten chronically stretched out ligaments. So if a person has chronically stretched out ligaments in their neck because of a car accident, because of a sporting injury or collision, because of the face down lifestyle with cell phones stretching out the ligaments, the ligament laxity can be documented by digital motion x-ray, and the ligaments tighten with prolotherapy. Prolotherapy is generally given about once a month. Normally, it's anywhere from 3 to 8 visits of prolotherapy. Once the ligaments are tightened and the cervical curve corrected, the impulses through the vagus nerve, the glossopharyngeal nerve, and facial nerve get back to normal. And once they do, there's the sensation and the functioning of the sensors in the tongue go back to normal.